The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 Long Island News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your health care needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of the patient's story. This is the time when our physician and patient relationship begins. The patient will explain their past medical history and then mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me. I listen to what they're saying, and I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you wait, it's too late. To my military family, I got your 6. To my Masonic brothers, the light is bright. Before we discuss today's topic, I would like to reintroduce Miss V. Miss V, welcome to the Ask Dr. Tommy O Show.
Thank you. It's good to be back. Thank you, doctor.
Yes, well, we had quite a scare.
Yeah, we did.
Yeah, well, what happened?
Well, based on the topic that you're discussing today, multiple sclerosis, I have multiple sclerosis, and I have a seizure disorder, and I had a really bad seizure, and I was on trying some new medications, and it didn't work out right with me, right. And it threw me backwards 10 steps.
Right.
Lost about 7 weeks there.
Yeah. Well, I received a phone call from your husband, Mike, and I, we were scared, and I said, get you to the hospital immediately.
Yeah.
You want to make sure you're doing well. Your family, so...
Thank you.
Really, really concerned. Not only that, we had several people, our audience, we asked for prayer warriors.
I had prayer warriors. Thank you so much for all your blessings and your prayers.
Yes, they're very important. We're working together. We're here to help each other as a community.
Yeah, it's a tough disease, and we're going to talk about it today. It's a tough disease, and it's that's not really spoken much about. Not many people know about it, so hopefully you can lift some eyebrows about it.
That's
and
right.
Some more information,
Say knowledge is power.
Knowledge is power.
Also, we say be proactive instead of being reactive. Mm-hmm. Set up an appointment today with Dr. Tommy O with me, and we'll set up a physical exam.
Yep.
All right. Again, if you wait, it's too late. We discussed that in several shows. I keep saying it. I'm going to keep burying it. Let's go. It's important to get this physical. We need a baseline so we can make decisions or be preventative. And that was the last show. We want to be preventative. All right. So now today's topic, multiple sclerosis. Mm-hmm. Well, let's talk about the office itself, and then we'll get into the topic and how clean the office is. And I have something very important that most offices don't have.
Oh, yeah. Dr. O'Brien has the most amazing system set up in his office. It's UV lights that just they sterilize, and they are ongoing. And I have never seen this in a doctor's office. It plugged into every room.
Right.
And it just basically sanitizes the whole
Whole office.
zone, the whole area there.
That's right. Yep.
And it's very good. Besides, it's very clean. The office, it's immaculate. So
Right.
I don't want to work anywhere that's not immaculate.
That's right. Well, we're here to protect the patients as well as us, because we are patients, we're humans, we're a community. You want to protect the community. So throughout the office, I have ultraviolet lights, and there have to be ultraviolet C lights, and that kills viruses, bacteria, and fungus, and also reduces the smell. Of course, my office is brand new. I didn't gut renovate it, but I did renovate it. So it's a new smelling office. It's clean.
Smells good.
It does. And it's an extension of my personality.
Yeah.
So, you go to other offices and your office is an extension of your personality. You go to an office and the walls are dirty, grimy.
Yeah. Or that green color, that doctor's office green color. So scary. Or you see the mildew and the wallpaper, it's peeling off. Yeah.
So that's not, you don't want to be. If this guy doesn't care about his office, does he care about me? So
it's like going to a restaurant and making sure the bathroom's clean. If it's not clean, I'm not eating there.
That's right. Yeah, we don't want that. No. All right, so we have that. Again, be proactive instead of reactive. So we want you to take advantage. Give us a call. Set up a history and physical. To learn more about my practice, I offer an affordable concierge practice at the price of less than the cost of a monthly cell bill, which allows you access to quality care you really deserve with no rushed office visits. Both you and I can discuss your healthcare needs. To learn more about my practice, go to drtommyo.com. That's drtommyo.com, or give us a call at 631-980-8200, 631-980-8200.
Yeah, definitely. Because the most practices that you go to, it's costs so much money, especially if you don't have insurance.
Right.
So to have an affordable cost of just $100 a month, and you can come and see you as needed. It's just
it's unheard of today. It's unheard of. You know, you're getting into you go to like an urgent care center. They're going to bang you for $150. You know, each time you come in, and they're going to upsell you. For every procedure they do. There's no upselling in Dr. Tommy O's practice in my office. That's not how I practice. I'm here to care for you, take care of the community. All right, so let's get into multiple sclerosis. So multiple sclerosis is a disease of the central nervous system. This is known as a demyelination disease. From that point on, I'll say MS. Multiple sclerosis is MS. In MS, the body's immune system attacks the myelin sheath. Now, let's talk about what the myelin sheath is. And I'm going to break it down into layman's terms so everyone understands. The myelin sheath serves as an insulator, much like the plastic that surrounds a power cord. All right, so we have a power cord, right? You plug it into a wall, and then you transmit electric from the wall, okay? That comes from the street, comes from a power plant, and it goes straight through into, let's say, a TV, because you have a TV on. Well, the electrons, so you have an insulator and you have a conductor. The conductor is the actual wires, the copper wires. It could be silver, it could be gold, if you have a lot of money. But for the rest of us, it's going to be copper wire, and that is the conductor.
Right.
And then you have the insulation, which is the plastic that surrounds the copper wire. And what the function of the insulator is to make sure that the current is very focused and going from point A to point B in a straight line, okay? Because you want the path of least resistance and going a short distance from point A to point B. And then it finally goes to the TV and turns the TV on when you hit the on button. Now, in the body, we have something very simple. Well, what's the power source? Well, the brain, okay, central nervous system. And say, well, what's the conductor? The conductor is the neuron. The neuron, all right? Now, what is the insulation? That's the myelin sheath, right? And that is, well, basically, it's fat that covers the neuron, which is the conductor. Now, the difference between a power wire versus a neuron, a power wire, the insulation is continuous. All right. There's no breaks in the insulation. So if we have breaks in the insulation, the signal starts to break down. Right. In the body, we do have breaks. And the reason why in the neuron, I'm talking about central nervous system, peripheral nervous system, we have breaks. And the reason for that breaks, it helps pick up speed. It moves so we can, when you have a reflex, you don't even think about it, and you move your body. Something hot, boom, you remove your hand. I mean, you don't even think about it. That's a reflex. That's how fast the neurons have to move. So in order to get that speed, we have in that pathway, we have little gaps so it skips. Yep. So that's how we pick up speed. However, with MS, right, we have the autoimmune disease where the body attacks that myelin sheath. That gap in between starts to increase. Mm-hmm. So that starts to slow down the neuron and the electrons that signal going from the central nervous system to the organ. The organ would be the TV, and that slows it down. And as that gap increases, then the speed of the signal decreases so much that the signal stops. And that's how basically all the signals are off.
Right. Yeah, and everything kind of goes out of control.
Right. So you still, the brain is still sending a signal, but the TV's not turning on. Okay. So the organ's not functioning, the muscle tissue, because that signal's not now stopped.
Right.
Okay. It's not moving forward. All right. I got 25 seconds. So I'm going to go into part 2. So, I offer very, very affordable concierge practice at less than the cost of a monthly cell bill, which allows you access to quality care you really deserve. To learn more about my practice, go to drtomio.com. That's drtomio.com, or give us a call at 631-980-8200. Welcome back to the Ask Dr. Tomio Show. I am your host, Dr. Thomas O'Brien. Today's topic, multiple sclerosis. Let's continue. All right, we ended with defining multiple sclerosis, MS. Let's just recap real quick, and then we'll start to go into the signs and symptoms. So multiple sclerosis is a demyelination disease, and that's where we start to lose the insulation that surrounds the conductor, which is the neuron, and that transmits the signal from the brain to the rest of the body. If we lose that signal, then we're not able to move, we're not able to function. All right, now every show I talk about structure is function. Without proper structure, there is no function. In this case, we have dysfunction because the structure is breaking down. The body attacks the myelin sheath. Again, as I stated earlier, that the gaps in between start to increase and that the signal starts to slow down, and eventually the signal stops and the neurons are not able to move forward to, like I said, the analogy would be a TV. In this case, it could be your muscles, whatever, any organ in the body, it's all affected. The same thing. We need those neurons to move forward, right, from point A to point B as quick as possible. All right, so let's get into what are signs and symptoms of MS. All right, so I have a list here. There are more, but these are the most common. So muscle weakness, often in the hands and the legs, tingling and burning sensation. We get numbness, chronic pain, coordination and balance problems, fatigue, vision problems, difficulty with bladder control, psychological issues as depression and difficulty with clarity. I'm talking about mental clarity. All right. So
that's a big one.
Exactly. You're like walking around in a fog here. Mm-hmm. All right. So before we go over something, I just want to make sure that everyone understands that, we're being HIPAA compliant, and I do have permission. Ms. V gave permission to discuss her condition here. This is for educational purposes. Very important. I have a lot of patients because, that's under my care for 20 years. And on my website, if you go to testimonials, we all have written testimonials. When you're good, patients want to, get their information out here. I have video testimonies on my website. So I have my patients literally putting themselves out there. They're just not writing and their name. They're actually, now you see their face. They're giving you the name. They're telling you about their condition and how I've helped them. That's because they want to help and educate the community on their condition and how I've helped them. We're doing the same here today. Ms. V. All right.
Yes.
We're talking about multiple sclerosis.
Well, thank you, doctor. Basically, it's a war. It's a war against your central nervous system. That's how I look at it. Right. And it started with me about 11 years ago. I didn't know what was wrong with me. I had been to thousands of doctors, and each of them told me something else that I had. They tried me on different medications. Nobody ever said anything about MS. Nobody knew what MS was. And it started with me with the coordination and the balance. Like I would like fall a lot.
Right.
Or I would be really tired one day. Or I would have the tingling or numbness in my fingertips. But it mostly was localized on my right side. It took one doctor in NYU Hospital to actually run a series of tests and did a MRI on me, which I couldn't really do because I'm allergic to contrast. So I had to do a regular MRI. So it took a lot for her to see it.
Right.
She had to send me for a special MRI, and she saw what was the beginning of lesions on my brain. And she said, well, I'm going to start you on something called baclofen. And that was back then, that was the only thing they knew what to do with, with MS. And they would just like give you pain pills and tell you to go home and call it a day. It wasn't anything big, but it was serious. Like I really battled for years, not understanding what I had. The disability I went through caused me to stop working. And at that time, the psychological issues and the depression that I went through caused it to be even worse and worse. And nobody knew much about it. Nobody wanted to even say there was no specialists. Mm-hmm. So now there's more specialists. And now I've tried almost every medication out there. Recently, that was one of the things that happened. One of the medications that I tried caused me to have a bad reaction and caused me to have more seizures than I usually have. That's one of the other symptoms is the seizures. I have what's known as non-epileptic seizure disorder. Mm-hmm. So that's like one of the more symptoms that comes later on in the disease. But nobody knew what to do. And when I met you and when we were together, we talked about different alternative ways to deal with it. And I'll be honest with you, the best thing that helped me was the medical marijuana. Right. And that just turned it into a whole new direction where I should be in a wheelchair today. Most doctors have told me, I can't believe you're not in a wheelchair, that I am able to function on a level. Yes, I do have good days and bad days, but I'm able to say that I'm at relapsing remitting stage and I am not in a wheelchair. Right. Yes, I'm disabled, but I'm not in a wheelchair. I'm not going to give in that quick, you know?
Right. Now you have to go out with a fight.
You got to go out with a fight, definitely, And I've been speaking about it for a long time, and that helps too. But, I developed it pretty late in the game, and I've had it for about 11 years. I'm 54 now. Right. So, it's symptoms come and go. It changes. Every day is different. Right. But the medical marijuana, I think that's key because that really helps if you want to.
We go over that. Yep. Yeah, typically when a patient comes in, with a neurological condition like multiple sclerosis, even like Parkinson's, Huntington's chorea, even ALS, Lou Gehrig's disease, I'll use a high CD, a very concentrated CD a dominant product, and then CBD has anti-inflammatory properties, and it helps reduces the tremors and seizures.
And that's one thing it helped. I used to have muscle spasms and tremors so bad that they would interfere with my daily living. And
exactly.
Once I started that slowed down a lot.
Right, exactly. Yeah. But it helps keep you very focused as well.
Yes.
If we can reduce the tremors, the key is the quality of life. I want to make my patients comfortable and functional. Yeah. This is not recreational where you're walking around high like Spicoli at Fast Times at Ridgemont High. Hey, where's my pizza?
That's the stigmata behind it. That it's like it's like using drugs like that. No, I look at it as I have a prescription for it. It's a real prescription and it's a medication and it helps save my life. So, yes. I don't look at it as anything recreational at all. Right. I take it very seriously,
Exactly. Well, not in this case, because when you go recreation, that's typically going to be a THC dominant plant. Yeah. And then you're going to get into the psychoactive properties. That's what I was looking for, and psychoactive properties again would be the stoner's high.
It happens.
Yeah. So you get the stoner's high, you can get paranoia, you get anxiety,
Yes.
you get the munchies, and then sedation.
You have to have the right prescription.
Right,
Yeah.
the right ratio, the proper ratio for a desired effect. Now, recreational, that's what they're looking for. They're looking for that, what we call head high.
Yeah.
But in medicine, we're not looking for that at all, because that's not what we're going for.
Right.
I want you comfortable and functional. I want you to be able to perform your daily activities. I don't want anyone knowing your business. I don't want anyone knowing. They should know that you're on medication.
Right.
It's personal, it's private, and that you're
I don't
able
really.
to perform your duties.
I don't. Well, now I'm out. I guess I came out now. I'm out the closet with it. But now that I put it on the radio, but it is medication to me. Because I'd rather be on a prescription dose of medical marijuana than be having to take pain pills for the rest of my life, because I know what that does. I've seen it and what it does to people, and it's I've been through it.
Sure.
So I am through it. So it's like it's better than having the pain pills that I have.
Exactly. Well, you're in control now. Not
exactly.
The pills controlling you.
Exactly.
One thing I like about the medical marijuana and medical cannabis is that I give you the necessary tools for you to manage your care, and you use it when you need it versus like narcotics or any other medication.
Right.
Every X amount of hours you have to take.
And that's something that's like, structured like the old school doctor structure. It's like, take one a day and call me in the morning. No, it's what as needed,
Right.
And you don't always need it, because your body gets to a certain level where you're just going to use it and it's going to be okay, and you're not going to get, sick from it.
All right. Well, I want to thank you. We're down to the last 30 seconds.
Wonderful.
Very important. You really helped to educate the community. Again, I want to thank you for sharing your story.
Thank you.
It's very, very important because there's a lot of people that suffer from multiple sclerosis. All right. You need a physician? Give us a call. All right. I offer a very affordable concierge practice. To learn more, go to drtomio.com. That's drtomio.com, or give us a call at 631-980-8200.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.